Central nervous system infections and metabolic diseases, specifically diabetic neuropathy. This module covers meningitis, syphilis, Lyme's disease, herpes simplex encephalitis, varicella zoster virus, rabies, progressive multifocal leukoencephalopathy, Wernicke syndrome, and diabetic neuropathy. Meningitis is inflammation of the meninges and the cerebral spinal fluid within the subarachnoid space. Meningioencephalitis refers to inflammation of the meninges surrounding the brain only. The most common cause of meningitis infection is either bacterial or viral, but meningitis can be caused by any kind of chemical irritant. There are three classifications of meningitis. One is acute pyogenic, two is acute aseptic, and three is chronic. Acute pyogenic meningitis is caused by a bacterial infection. Acute aseptic meningitis is caused by a viral infection. And chronic meningitis can be caused by tuberculosis or a spirochetal infection or cryptococcal infection. According to the 2017 CDC statistics, meningococcal meningitis can be caused by Neisseria meningitis. The rates have declined since 1990, which is good. There's 350 cases reported in 2017, which is about 0.11 per 100,000. The highest risks are young adults between the ages of 16 and 23 years old. 10 to 15 out of those who contract meningitis, 10 to 15 out of 100 will die from this condition. 1 to 5 will survive but will have some long-term disability. Acute pyogenic meningitis is caused by a bacterial infection. Each age group has a different type of bacteria that is the common cause of it. For neonates, it's Escherichia coli and group B streptococci. For older adults, it is Streptococcus pneumoniae and Listeria monocytogenes. For adolescents and younger adults, it's Neisseria meningitis. Bacterial meningitis or acute pyogenic meningitis is fatal if untreated and requires antibiotics. The symptoms are fever, headache, eye sensitive to lights, neck stiffness, irritability. These are all common symptoms that often bring somebody into a chiropractic office. In fact, where I practice in Virginia, which was a college town similar to this area of the upstate, this is really considered a college town too, with so many colleges and universities around it. I had several cases of meningitis in my office, always in the fall. So the individuals would come to my office. Many of them were already regular patients, but they were college students, and they would say, I woke up, I have severe neck pain, I have a headache, I know I need an adjustment. And many of them I was able to diagnose that they had meningitis. Not all of them was bacterial. Most of them actually was viral, but it needed acute treatment right away. So be careful in the clinic, since this is a college town with students coming in. If they're presenting with a sudden fever, headache, neck pain, neck stiffness, you'll be taught specific orthopedic tests also to kind of rule out meningitis. It's called a Linder's test, where you stretch the meninges, and if they get an electrical shock down their spine, that is a red flag. But I just want you to be aware that a lot of the early signs and symptoms of both acute pyogenic, and then we'll talk about acute aseptic meningitis in a minute, are the same. So they also mimic signs and symptoms that people seek chiropractic treatment for. Acute pyogenic meningitis diagnosis is often done with a spinal tap, where the cerebral spinal fluid is extracted and viewed under microscope. It could be cloudy or frankly purulent, meaning it's got pus in it, a lot of neutrophils, can have 90,000 plus neutrophils in it. It'll show increased proteins and may have reduced glucose in the CSF fluid. On a culture smear, you'll be able to see the bacteria, and you may be able to see a lot of neutrophils in the CSF that's responding to the inflammation. Acute aseptic meningitis is the clinical term that applies to a patient who manifests all the symptoms of meningitis, all the symptoms of acute pyogenic meningitis, but their cerebral spinal fluid, spinal tap, or blood culture is negative for bacteria. It's most commonly caused by viruses, but most specifically by enterovirus, and it could be a rickettsial type infection as well. Symptoms are very similar to pyogenic: fever, irritation, headache, neck pain, all the same symptoms, but not quite as severe of the level as what pyogenic meningitis can present. The cerebral spinal fluid findings of acute aseptic meningitis will show increased lymphocytes because it's a viral infection, and it'll have a normal amount of neutrophils and only a moderate elevation in protein and normal glucose levels typically. Acute aseptic meningitis is self-limiting, and it says here on your slide that it's treated symptomatically. However, it's been my experience working in a college town, because meningitis is lethal, the pyogenic is lethal, that any students presenting with signs and symptoms of meningitis, they simply start a antibiotic treatment right away on them and often don't even bother with CSF fluid tests, the spinal test, unless the antibiotics are not working. Chronic meningitis can be caused by tuberculosis, Mycobacterium tuberculosis, or a spirochetal bacteria such as Lyme disease or neurosyphilis, a cryptococcal fungal infection, and parasites such as malaria, protozoa, and toxoplasmosis. Meningitis typical population. Who is the most at risk? It's people living or spending their day in close quarters, such as young children in daycare centers, ages 0 to 3, and older children and young adults living in dormitories or military barracks. And it doesn't say on here, but it also would include the elderly living in nursing homes, because it is an airborne pathogen. Meningitis pathogens, bacteria, or virus is usually acquired through close contact with secretion or droplets. This example shows somebody sneezing and how far all those respiratory droplets can travel. Bacteria or viruses will enter the body through respiratory and digestive systems, then enter the bloodstream. Neurosyphilis. This is the state where syphilis reaches the central nervous system. The tertiary stage of syphilis and neurological conditions and symptoms is neurosyphilis. Meningovascular neurosyphilis will cause meningitis. Paretic neurosyphilis will lead to dementia. And Tabes dorsalis, which is the one I'm going to emphasize the most, will cause a loss of joint proprioception, can lead to an ataxic type gait. The individual have loss of pain and sensation and can lead to skin and joint damage. Tabes dorsalis is the phase of syphilis that results from damage to sensory axons in the dorsal root and affects the dorsal horn. It leads to atrophy of the dorsal white columns. It damages the myelin in the fasciculus gracilis and the fasciculus cuneatus. This affects an a person to be able to have sensory information, discriminative touch, vibration, and they'll lose joint proprioception. Lyme's disease is caused by a spirochete bacteria, Borrelia burgdorferi, and it's transmitted to humans through a deer tick bite. Lyme's disease, most common symptom or sign is arrhythmia migrans, or a red rash, typically called the bullseye rash, and then it occurs at the tick bite site. The spirochete will affect both the central nervous system and the peripheral nervous system. As a side note, I want to tell you that in my practice, I had several hundred people over the years, several hundreds of people that had Lyme's disease, and not one of them ever saw a bullseye rash. It is classic for Lyme's disease, but don't count on your patient having observed it or you observed it to diagnose it. It often has to be diagnosed by actually isolating the spirochete. Lyme's disease early stages can occur days, weeks, or months after the initial exposure. The patient will present with flu-like symptoms. They'll have fevers, chill, headache, fatigue, stiff neck, malaise, arthralgia. They're just going to be miserable. And then it can spread to different systems of the body and ultimately end up like fibromyalgic-like symptoms where they have several trigger points and soreness of lots of their full body skeletal muscle system. And then they'll develop or can develop neurological symptoms such as meningitis. That would be advanced untreated Lyme's disease. Neuroborealis is the name given if Lyme disease involves the nervous system. It'll manifest as neurological symptoms such as chronic meningitis, polyradiculoneuropathy. It can also cause nerve paralysis, such as seen in Bell's palsy, and it can lead to encephalopathy, inflammation of the parenchyma in the brain. Late stages can begin months to years after the initial infection, and the most common symptom is arthritis or inflammation and pain of the joints, particularly the knee. And that was actually a key red flag for me in my practice with young children who had Lyme's disease. They would present with severe knee pain or chronic knee pain, and I would examine their knee joint and find nothing wrong with the knee joint, no crepitus, no joint bodies, full range of motion, without pain, but the pain was just internal. And we did some blood tests and found the spirochete. So they had contracted Lyme's disease, never noticed that they had the tick bite, never saw a red bullseye rash. But it wasn't until they developed the knee pain that was a red flag for me. Herpes simplex encephalitis. This is a sexually transmitted disease and is the major cause of fetal sporadic encephalitis in the United States. And what causes that is a baby going through vaginal birth through an infected mother. This involves the temporal lobe and orbital surfaces of the frontal lobe, so you know that it also leads to frontal temporal lobar degeneration. Neonates and individuals with compromised cellular immunity are the most at risk. There's antiviral treatments that now provide effective treatment, but all the antiviral treatments do is prevent the virus from replicating when it's active. It doesn't prevent it from lying dormant, and once it's there, once it's active in the vaginal tract, the medication isn't going to prevent the baby from catching it or from contracting it through birth. And these women should have cesarean to help prevent their baby from getting this herpes simplex encephalitis. Varicella-Zoster virus is chickenpox. It's the most common viral infection of the peripheral nervous system. It infects keratinocytes in the skin, and it's marked by vesicular skin eruptions. It is highly contagious but self-limiting in a healthy person or a healthy child. It can be very serious, though, in the elderly or immunocompromised individuals. The virus will lie dormant within sensory nerve ganglia or in the trigeminal ganglia and can reactivate in adults and manifest as a condition called shingles. Shingles, or herpes zoster virus, is vesicular eruptions that follow a specific sensory dermatome pattern. It's very painful. The most common area is the thoracic region or the trigeminal nerve dermatome. Reaction cause is unknown, but it is thought to be caused by stress. It is not as contagious as chickenpox, but it is contagious. I've treated many patients in my clinic who had active shingles, and I would actually just glove up to adjust them to make sure that I didn't get it or spread it further to the patient's body or spread it to any other patients. Rabies is severe viral encephalitis transmitted to humans by the bite of a rabid animal. It also can be transmitted to a human by the bite of a rabid human. It may involve the basal ganglia, spinal cord, dorsal root ganglia. It's diagnosed by microscopically identifying Nigra bodies within the central nervous system neurons. That's the key red flag for diagnosing rabies. Rabies will travel along peripheral nerves from the bite wound site to the central nervous system via retrograde axoplasmic transport. Symptoms will appear within 2 to 10 days, and that depends on how far away the bite is, the peripheral neuron is to the central nervous system. So, for example, if somebody got bit in the foot, it would take a lot longer for retrograde exoplasmic transport for it to reach the cell body within the spinal cord. However, if somebody got bit in the face, it wouldn't take as long. Initial symptoms are flu-like, fever, headache, general weakness, or discomfort. As the rabies disease progresses, more specific symptoms appear, such as agitation, anxiety, confusion, hyperactivity, difficulty swallowing, excess salivation, which leads to the difficulty swallowing, fear of drinking water. They're producing so much saliva they almost feel like they're drowning, so they don't want any more liquid in their body. They'll present with hallucinations, insomnia, and have partial paralysis. Once a person begins showing the signs and symptoms of the rabies, death is within a few days. So individuals who are bitten must seek treatment for the rabies virus immediately before it gets to the central nervous system in order to survive. Take 10. Progressive multifocal leukoencephalopathy. I think I got it out this time. It is the common word. It's caused by JC polyomavirus or papovirus. It's typically not harmful in a healthy individual, but it can lay dormant. And it's linked to demyelinization of central nervous system axons. This is caused or can be caused by This can cause viral encephalitis in immunosuppressed individuals. Immunosuppressed individuals are individuals who have AIDS or full-blown AIDS or cancer patient on chemotherapy. If you as a practitioner develop a wart on your hand, you should glove up before you palpate or touch another person. And if you have a patient that you see warts on, you should educate them in the fact that they are contagious and that they are a virus. And it's very simple to get rid of them. You just go to any pharmacy and get salicylic acid liquid and put it on the wart, cover it with a Band-Aid, in a few days it falls off. Wernicke's encephalopathy. Thiamine, which is vitamin B1, deficiency leads to Wernicke's encephalopathy or Wernicke syndrome. B1 plays a role in the synthesis of acetylcholine, which is a very important neurotransmitter. Causes of Wernicke syndrome is alcoholism, which is the most common cause, but it can be caused by individuals affected with gastritis disorders such as carcinoma, chronic gastritis, Crohn's disease, or persistent vomiting. Some of the symptoms associated with Wernicke's encephalopathy are ophthalmoplegia, which is paralysis or weakness of one or more intrinsic eye muscles. They'll manifest with nystagmus when you do an eye exam or a clinical exam, and it can lead to some psychotic symptoms sometimes. And if untreated, it causes a syndrome called Korsakoff syndrome, and it's abbreviated as CAP, C-A-P, standing for C is confabulation, A is amnesia, and B is personality changes. Diabetic neuropathy is the most common cause of peripheral neuropathy. The prevalence and complication depends on the duration of this disease. Overall, it affects 50% of patients with untreated or uncontrolled diabetes. It can affect up to 80% of diabetics who have had the disease for more than 15 years. Again, I want to stress uncontrolled disease. Many individuals, especially today with new technology and with insertion of pumps and artificial pancreas, the hyperglycemia is very well controlled. So I want to stress that diabetic neuropathy these numbers affect individuals who are not able to control their glucose levels. It affects both type 1 and type 2 diabetics. It can cause demyelination of an axon or degeneration of axon fibers, or both. Diabetic neuropathy is a distal sensory motor neuropathy. It can injure the nerve fibers throughout the body, but it most often damages the nerves in the legs and the feet, the nerves or neurons that have the longest axons. It can lead to chronic skin ulcers, which also can lead to amputation. What you see here on the slide, I have seen every one of these stages on patients in my office. And when I have a patient who is diabetic, every time they come in, I ask them to take off their shoes and let me look at their feet so I can monitor any skin breakdown or changes in their feet as a result of possible diabetic neuropathy. Some symptoms of diabetic neuropathy are numbness, tingling, like pins and needles sensation, a burning pain, can be a sharp pain. We've learned in neuromuscle, or we will learn that the difference between those two is whether it's going through a fast pathway or a slow pathway. It can cause muscle cramps and hypersensitivity of the skin. There's many symptoms associated with diabetic neuropathy, but the most common one is the pins and needles sensation. Uncontrolled hyperglycemia will damage microvessels that supply the endoneurium surrounding axons. So, as all tissues in the body, nerves and axons need to have a blood supply as well. And these are very tiny vessels that supply the neurons and the axons within nerves. These microvessels will become leaky when they are damaged by hyperglycemia. These leaky vessels cannot supply adequate nutrients to the tissues they're innervating, especially oxygen. Peripheral nerves do not have an abundant vascular supply, so any decrease in oxygen delivery will cause ischemic conditions. Ischemic conditions cause a toxic environment, and it can lead to degeneration of the affected axon within the whole nerve. Leaky vessels also reduce the delivery of nerve growth factor to the interstitial fluid of the synaptic cleft. NGF, or nerve growth factor, is required to stimulate the DNA of a neuron to produce the necessary structures needed for nerve repair and nerve maintenance. Nerve growth factor is transported to the soma via retrograde transport from the axon terminal. We covered this in neuro and muscle physiology. In diabetic neuropathy, peripheral nerves going from the cell body to the axon terminal in the foot are very long. In some individuals who are over 6 feet, that axon could be 2.5 feet long. If a neuron cell body is not receiving adequate oxygen from the damaged microvessels, it will lack the energy to produce the structures necessary for normal axon maintenance and the energy to transport those products down the axon via anterograde exoplasmic transport. Axons need to be able to maintain or be maintained, or they will deteriorate. Axons always need to have their phospholipid membrane replaced, their neurolemma. They need to have old deteriorated organelles replaced. They need to have mitochondria replaced. They need to have new transport proteins made and put in their membrane. And all that stuff is made at the cell body and requires energy. If exoplasmic transport neurotubules begin to deteriorate due to lack of maintenance, the axon will not be able to transport nerve growth factor from the axon terminal to the cell body. This is why most diabetic neuropathies affect the distal aspects of the extremities, as they are innervated by the longest nerves in the body. Diabetic neuropathy can also affect autonomic neurons, specifically the vagus nerve, which is also has very long axons, but it's most notably in the peripheral system, affecting typically first the feet and then the hands.